Hello, my name is Dr. Brian Abelson. Today I'm going to talk about the peroneal nerve or peroneal nerve, sometimes known as the fibular nerve in some old textbooks. So what we're going to do is we're going to actually go through a little bit of the anatomy, talk about a little bit of its clinical significance, and then we're going to show you some specific exercises for both flossing and tensioning the nerve. Okay, let's talk about the anatomy a little bit here. Okay, if we look at the back of the leg, most of us know about the sciatic nerve coming down the back. Gets around the knee here, and we have the tibial bone in the front, fibular bone on the side. The fibular head up here, this is actually where we get a bifurcation or a separating of the sciatic nerve. One area turns in the tibial, down the back, and then we have the peroneal. Peroneal divides into two nerves. One is quite deep, the deep peroneal nerve, and the superficial branch, basically heading down, going underneath the muscle in the front here called the tibialis anterior. Point being, as it goes down, superficial branch goes more just in front of the bone here on the front, two little divisions there. The deep one comes out on the front here. We can commonly injure this nerve during several activities. Sitting at a desk, crossing the leg over, staying in that position a while. We may get some compression or compromise of the nerve. So we'll start to get a little bit of numbness, tingling, altered sensation down the side of the leg. If our leg is kept in kind of a hyperflexed position here, that may also cause a problem, and we'll get a little bit of compromise and compression on the nerve here. In any case, we'll get an altered sensation down the side. We also may find that we get a little bit of weakness. We'll get weakness on what we refer to as dorsiflexion. We'll also know when a person walks down the hall, we may see they're kind of dragging their foot a little bit. And it seems like the foot, when it goes into plantar flexion, it's almost like the back of the toe kind of scrapes the ground a little bit. So let's get into some specifics about some exercises. We're going to go over a number of things, fairly gentle ones, and a few that are a little more dynamic.
Hi, Dr. Evangelos Milonas. Today we'll be looking at some tensioning and flossing exercises for the peroneal nerve. We've got Sam here in position. We're going to have her bring her leg up, and this is the starting position. You're going to want her to straighten the leg. At the end of this motion, bring the foot inwards and the toes slightly back. And you're going to have this is a dynamic motion, so you're going to be doing this continually in that position, like that. And so what we're creating here is movement, mobilization of the nerve, focusing on the tensioning and the flossing aspect of the exercise. You can increase, decrease tension by working with the head. So as Sam's doing this, she can either bring her chin up or same motion and then bringing the head back. And that's going to create a glide in the nerve. So this is just a simple mobilizing exercise for the peroneal nerve.
On this next exercise, we're going to do this in a sitting position. And what we're going to do is we're actually going to take the leg while we're sitting down, and we're going to bring it up, flex it into what we call a dorsiflexion position. And then we're going to get Sam here to bring it down and kind of point like this and bring it in slightly like this into inversion. Bring it right back, taking it down, and bringing it in like this. If we started to bring this up a little bit more, we'd actually be doing a little different branch of the peroneal nerve. As we go down here, and we call basically plantar flexed, with the toes down in this position, a little bit of inversion. This is the section which is the deep peroneal nerve. If we take the foot over slightly a bit more, that's going to be the superficial branches. Interesting thing, if we kind of look at where we're tensioning or flossing the nerve, the deep branch goes underneath a band of connective tissue, which acts as kind of like a pulley system for the tendons here, which is called the retinaculum. The superficial branch, which divides into two here, goes over top of that retinaculum. So again, we're going to basically just take it back and we're going to glide it through like this. And we're not going to hold the position very long because this is not a stretch. This is a gliding or mobilization of the peroneal nerve. And as we go through that, if we want Sam to actually increase the amount of tension on there, we're going to change head position. So as we go back and forth here, we'll either have her head coming down when we go forward or we're going back. So let's just let Sam give this a try here. Go ahead and take it out. Out. Good, so this is just the standard one here. And then we're going to do it with bringing the foot over just a bit more so we actually get into the superficial. Very good. And then we're going to have her introduce some head motion to this. So first we're going to take it down into flexion. And we probably do this 5 to 10 times, somewhere in that vicinity. And then what we do is actually change it around and we bring it into extension with each of these motions. So by doing this, one way we're actually getting the nerve to glide through the tissue. On the other hand, if we're tensioning, we're actually pulling from both ends and we're actually tensioning the nerve. This is a great exercise for mobilizing or flossing, tensioning the peroneal nerve. Okay, on the next exercise we're going to use for mobilizing the peroneal nerve, it's very similar to a ballet technique actually. In this case, we're going to have Sam here take your right leg, bring it behind the left leg, and go on top of the foot, putting a little bit of pressure on there, not too much. But once we're in this position, we're going to have her lean forward as if she's bending over to bow. Excellent. And we're going to have her go back and forth, up and down here about 5 times. Moving down. Excellent. Okay, after she's done 5 times, then we'll have her come forward. And from this point, we're going to increase the amount of tension on the nerve by taking the head back and forth into flexion and slight extension, and then back and forth into flexion and extension. Again, about 5 times. This is a really good exercise for mobilization of the nerve, especially for people that are involved in ballet, because this is a common nerve that's actually entrapped. We talked before about crossing legs over, a little bit of tension behind the fibular head here, which can cause compression, but people who are involved in ballet classes commonly get compression of this nerve. Great adjunct exercise to what you're already doing in ballet.
Sam, place your leg on the table here. What you want to make sure you're doing is pointing the foot down and turning it inwards. So we're incorporating the hamstring stretch with the nerve mobilization. Then you're going to bend forward, turning to the side. Now this position could place a bit of strain on the back, so you don't want to hold it for too long. And then you're going to have Sam come back. We can combine an element of tensioning and flossing by creating head motion. So basically having Sam come down again, and this time maybe tucking her chin downwards, holding it for a few seconds, and then coming back to a neutral position, giving the back a chance to recuperate and rest. You want to perform these motions about 5 times with the head coming downwards, and then about another 5 times with the head coming backwards, creating tensioning and flossing, movement of the nerve.